Hi everyone, my name is Katherine Sharp. I'm going to be talking to you today about the real principles for motivational interviewing. So motivational interviewing, it's an effective evidence-based method to talk to individuals about behavior change, and it really works to explore ambivalence, which is a normal process in behavior change. And so there's some motivational interviewing core tenets that you can think about to remember, and those are the real principles, and they include avoiding the writing reflex, lead with empathy, explore ambivalence, and listen for patients' own perspective to understand and empower. So to start, it's R, or writing reflex. So you're really trying to avoid that writing reflex. And so the writing reflex is where you're just telling patients what to do, you're persuading, you're giving speeches, you're being very directive. And instead, you want to try to engage patients and explore their barriers and really be in a partnership to come up with a plan that's going to work for them and work for you to make that behavior change. So an example of this might be if you ever went to a family dinner and say it was COVID or it was winter and you gained some weight and you're talking about your diet and how you want to make changes to your diet, and the family member says, well, you should cut out carbs. And for you, maybe you tried this in the past, it didn't work, or maybe you've been exploring other options and you're interested in maybe increasing your fruits, your vegetables, or eating healthier carbs instead of completely cutting them out, or changing how much fat you're eating. Well, you're interested in trying something else, and the family member is simply telling you what you should do and telling you what worked for them but might not work for you. So you're trying to avoid that writing reflex, avoid just simply telling someone what to do, and instead you're trying to get at how can we make this change, what would work for them. So the next part of the real principles is E, or empathy. So you're trying to build trust and collaboration with the individual that you're talking to. And some of the ways or techniques that you can use when you're thinking about empathy is asking open-ended questions, asking for permission, and really working towards listening or using reflective listening. You can use simple or complex reflections. And some examples would be asking for permission. Would you be willing to discuss your diet? Asking open-ended questions. What do you think it would be like to change your diet? And then example of a simple reflection might be if the person you're talking to said, I want to change my diet, but I don't know how. And you might reflect and say, you're at a loss for how to even start this dietary change. So the next part of the real principles is ambivalence. So you're trying to uncover discrepancy between their actions and their thoughts about the behavior change. And so some of the ways you might do this is recalling times before the behavior was a problem, facilitating patient imagination with or without the behavior, connecting patient values with their behaviors, or using scaling questions. An example might be if you say, what do you think your life would be like in 5 years if you didn't change your diet? Or an example of a scaling question might be, how important is it for you to change your diet on a scale from 1 to 10, 10 being the most important? And if they say, oh, I would choose a 6, you might say, why did you pick a 6 instead of a 3? And they might tell you, well, I was diagnosed with prediabetes and I really want to make these dietary changes so I don't develop diabetes. So the next part of the real principles is L. So you're listening in order to understand and empower the individuals that you're working with. So you want to listen for that change talk and support their self-efficacy. And if you're hearing that change talk, it's a really good sign that they're willing to make these changes and you want to move forward and enhance that change talk. And you're going to support and encourage their strengths and their successes. If they choose a SMART goal, you're going to really work off of that and help patients generate action plans each visit surrounding that goal. And then you're going to arrange follow-up and encourage accountability for those goals. So really checking in on those goals and seeing how they did or what were some barriers to those goals. So you're really listening and understanding, empowering during the visit to make sure that they're working towards those goals that you guys decide upon. So I included some resources that you can use to understand more about motivational interviewing, understand more about the real principles, and explore more about behavior change if you're interested. And then there's also some links to resources, including some articles that will discuss motivational interviewing more versus more traditional interviewing and what kind of conditions it might work for. So feel free to look into those, and thank you.